Some say it's a big victory for the American people. Others say the cuts just go too deep. Tonight, we're taking a deep dive to show you how the big, beautiful bill will affect your bottom line. Now, we know there are so many families out there in Metro Detroit working to make ends meet, and know it's important to know what could be coming your way.
Yeah, and with the president's so-called big, beautiful bill close to passing in the House, we wanted to break down what could be coming in the future. So let's get out to our Jay Scott Smith live for us tonight. So, Jay, there's a lot in that bill.
Yeah, Damon and Karen, there really is. This bill was so contentious that it needed a tie-breaking vote to get out of the Senate. Now, there are a lot of concerns over the impact it's going to have, particularly on people's health.
The main parts of the more than 900-page bill renew the tax cuts Trump signed into law in his first term and pays for them with steep cuts to Medicaid, food aid programs, and clean energy funding.
It is the largest cut in health care in the history of this country, helping people get access to health care, and is also the largest cut in food assistance.
Congresswoman Debbie Dingell voted against the bill when it first passed through the House and will vote against it again, saying the effect it will have on seniors and people with serious medical conditions could be catastrophic.
More people are going to end up in the emergency room. Seniors, it reduces staffing for nursing homes that help take care of seniors or those with disabilities or need a helping hand.
According to the latest projections from the nonpartisan Congressional Budget Office, over the next 10 years, the legislation would cause revenues to decrease by about $4.5 trillion, while cutting spending by $1.2 trillion and increasing the national debt by $3.3 trillion. Monique Stanton, the CEO of the Michigan League for Public Policy, says the cuts in the bill are going to hurt everyone, regardless of who they voted for.
We have polling that shows over 80% of Michiganders believe that funding for Medicaid either needs to stay the same or increase. There's wide support for this, and this is not a red or blue issue.
The bill now heads back to the House, where a vote on the bill will likely be coming in the next 24 to 36 hours. Congresswoman Dingell says it's a vote that her Republican colleagues will have to live with.
One of my dear friends said how hard this vote was for her. And as much as I love her, think about how hard it is because somebody's going to lose their home or have to make a decision about whether their child can continue to go to the doctor.
Now, Governor Whitmer also responded to the bill passing the Senate today, saying, quote, today Republicans in the United States Senate approved a series of cruel and extreme cuts to Medicaid and SNAP benefits for millions of Americans. Quote, let me be clear with today's decision. Republicans have sacrificed the health and well-being of hardworking American families to pay for sweeping tax cuts for the wealthiest among us. Now, a vote on this bill, or should I say a vote on where the bill is expected. The bill is expected to be voted on tomorrow morning. It's going to happen likely around 9 a.m. At least that's from what I heard from Congresswoman Dingell.
All right, and that is the Democratic side of the story. Of course, we've been covering the Republican side as well, and we'll have more on that on Click on Detroit. All right, thanks, Jay.